Hi, this is Dr. Cliff Gronseth coming to you with another Dr. Cliff's Riffs. Today we're going to be talking about neck pain. We'll do a broad overview about the possible sources of neck pain, things to be worried about, and some of the treatment options, some of the advanced treatment options that we can provide here at Spine West. So dive right into it. So neck pain is fairly complicated. It is a series of stacked bones that oftentimes can go awry, cause a lot of pain, both in the muscles and in the joints themselves. Now, the spine is made up of many different segments of bones that you can see here that will sometimes get out of alignment, and over time they can wear out. If you look at these side view of the neck, you can see that they've got the vertebrae with these small little joints in the back. These are little stabilizing joints called facet joints right there. They have a little bit of cartilage in them, and we'll talk about that in a little bit. The other thing that you have is the spacing in between the bones, which is where the discs sit. The discs are little cushions in between the bones that provide a little bit of stability, and the spine is held together with a lot of ligaments that go up and down the front and the back of the spine. The key thing, though, is that there's multiple places where the neck pain can originate. And we'll go through some of those today, some of the big red flags, the big worrisome ones, and then some of these kind of natural aging or kind of a birthday accumulation diseases, so to speak, that we can get. Now, there's two types of neck pain. There's the whiplash type of pain where you have a sudden stretch of the neck and the muscles, and that can cause both injury to the muscles or to the ligaments themselves. And that can usually be very severe the following day, as just like you've worked out too much and your muscles are sore. So oftentimes the pain occurs worse 24 hours later. If you have pain immediately, that usually implies as a little bit more of a serious tear or fracture or something that really should be evaluated quickly. A whiplash injury tends to self-resolve with time. You have to just get the physical therapy, relax, stretch, try to keep moving as much as you can. Sometimes the medications will help with that, and you can use some different types of muscle relaxants and things that will allow you to just kind of calm the muscles down. But oftentimes a stretch injury will typically resolve with Mother Nature's help. The problem happens, or the concern happens, when you start to get pain that lasts more than 6 weeks. Then you start to get this worry about either there was injury to the facet joints, these small little stabilizing joints in the back, or possibly some of the discs. If you have pain that goes beyond the neck and it radiates into the arm, that is worrisome, because that may imply that you've got some type of pinched nerve. When you have a pinched nerve, you will sometimes get this radiating pain down into the arm, and it can go as far as the hand or the wrist, and that is something that we definitely want to pursue, because we don't like to injure or mess with the nerves. Nerves always have priority. Muscles will usually heal. Bone fractures will usually heal. Nerves, not so much. So you really want to be careful about any type of radiating pain associated with numbness or weakness after a whiplash, or any type of neck pain at any time, whether it's acute or chronic. The other thing is that the neck is very closely associated with the head and the brain, and it can sometimes cause migraine headaches. You can see sometimes the vessels, the blood vessels that go through the neck up into the skull, will sometimes induce migraine headaches, and you can have what's called cervicogenic headaches, which means that the neck originates the pain and then it spreads and causes a headache. Not always as successfully treatable with the standard mechanical type of neck pain that happens when you injure a ligament, a muscle, or even if you break a bone. You break a bone, usually heals as long as it's stable. But if you have pain that radiates into the head, you always want to be concerned about something a little bit more serious. And so you need more advanced studies besides just an X-ray. Now, an X-ray is very useful for looking for stability. You always want to make sure that there's no evidence of movement in the spine. This is a flexion X-ray, and you can see that the back of the vertebrae stay fairly lined up, which is very important because if there's shifting that's going on, that can be dangerous. It may pinch nerves. It could pinch even the spinal cord. So getting lateral flexion extension X-rays, certainly after whiplash injury, but even with chronic pain, you can get some segmental instability on the throughout the neck and the cervical spine. And then you start talking about the more common things like little disc bulges. You can see here there's a little bit of a indentation in this little disc right behind this disc here. It's pushing on the spinal cord a little bit. The spinal cord is this ribbon that runs right down the back of the spine there. The white that you see around this spinal cord is actually like a water jacket. It's like a little protective cushioning for the spinal cord that can kind of bounce around inside of your neck. Think of a soccer player, something that's whipping their head around. That cord is protected by this water jacket. But when you've got these discs that bulge into the space where the spinal cord runs, called the central canal, you can start to get some injury. For example, this one, you can see that there's a little bit more of a bulge that's impinging on the spinal cord, and that can cause either pressure on the cord or more likely it's going to be radiating into the arm, something that we take very seriously because, like I said, you never want to squeeze the nerves too hard. Here you can see a piece of disc which is actually leaked out and it just lodged inside of this spinal canal right here. You can see it actually tents the covering of the spinal cord right there. And so we would watch that, or we'd look at the reflexes very carefully to make sure that the spinal cord is not at risk. You can also have these odd red herring findings sometimes when we get an MRI, such as little tumors that can sit and grow inside the spine. Sometimes they're benign, sometimes they're not. So, sometimes they're a sign of something a little bit more serious. But we do see those occasionally. It's not the norm, but it always is good to do a screening for this type of thing if you have chronic neck pain. The other thing that you can get is just as we season, you can see that the spine starts to lose its nice alignment and it starts to get a little bit disorganized. And the spinal cord will find its way through the spinal canal as best it can, usually will accommodate the slow degeneration that we acquire, these unwanted birthday gifts. But sometimes it really gets tight, and you can see that it really has to take a really tight pathway through the neck. And in this case, you can see how straight this spinal cord is above and below this little twisty area. So this type of situation is actually dangerous. If you took a serious fall or a whiplash injury, there's not a lot of room around that spinal cord to protect it. The water jacket that we talked about, that little fluid-filled sac of inside the dura, is now squeezed down tight, and you've got these bone spurs and discs that are sitting right on the cord, ready to just jab it if you have significant trauma. And if you do have trauma, you can start to get little segmental changes in the cord. Here it's very subtle, but you can see this little white signal inside the cord, which means that it's getting damaged. And you always want to protect the spinal cord. That's a giant cable of nerves that runs down the back of the spine, and then it dispenses, or it branches into separate little nerves that go into your arms and legs. But this type of situation can sometimes be associated with some incoordination of your hand, or you have difficulty walking with spasticity. That's always big concern, something we screen for whenever you get evaluated here. And then you've got these other unusual cases. This is a little, what's called a syrinx. It's a little fluid collection that has acquired inside the spine. Sometimes it's associated with an old injury, an old whiplash injury, some kind of trauma that will cause this bubbling. Sometimes it causes symptoms. Sometimes it's just an incidental finding. So you have to correlate it with the clinical symptoms and the physical exam to see if that's something that needs to be addressed. A lot of times we'll watch those types of little fluid pockets. Sometimes a neurosurgeon can put a little drain in them and drain them into your abdomen if it really is suspected of being symptomatic. So we have surgical and we have non-surgical treatment options. Now, the non-surgical options, as you know, are oftentimes the relative rest, medications, physical therapy, massage, and chiropractic sometimes to just relieve some of the neck pain. But you have to be careful that you're not going to cause harm with any type of aggressive manipulation before you do it. So it's always wise to get an MRI to make sure you don't have something like this or like this, where suddenly a little bit of too much pressure, a little bit too much twisting can cause some harm. So the other thing that can happen is you can get arthritis. And arthritis is oftentimes just an associated kind of a accumulation of bone spurs and creaky joints, rust spots that just develop along the spine. You can see in this reconstructed CT scan, you've got these little bony spurs that stick off the ends of the bones here, and this spine is likely not 20 years old. It's a little bit more seasoned, a little bit wiser, and this one can or may not hurt, because even though you've got a lot of arthritis that you can see here, it may not always be symptomatic. Sometimes it is, sometimes it's not. In this case, you can see that there's small little bone spurs on one side of the neck. You can see these little angled joints down here, and you've got these little chicken lips looking things that will develop over time. A little bit like a stalactite in a cave, drip by drip, the body will lay down a little bit of calcium when there's irritation in the area. You can see the other side of the neck has fairly nice and clean joints, but this side is obviously a little bit weathered and worn out. Now, this would be a chief suspect of a source of pain because that joint has lost its cartilage. You can see here there's lots of spacing between the bones, and over here there's none. So this is where we would look if you've got a one-sided neck pain that's worse with movement, doesn't radiate into the arm, and this would be a mechanical type reproducible pain. Sometimes you can get these bone spurs that will cause narrowing in the spine. So if you can look closely, you can possibly see these little black peanut-shaped holes. That's where the nerves exit the spine. This one is also wide open. But look at this one. This one is narrowed down because you have this bony overgrowth right up here, and that's just slowly moved into the hole where the nerve exits the spine, and that will cause this radiating pain, sometimes associated with numbness, weakness. And so those are things that we always want to look for, because we never want to compress or squeeze a nerve so that it gets damaged, because we're not able in medicine to actually grow nerves very well. And the facet joints, though, they will degenerate. You can see here that this joint right here, this is a little bit of a facet joint with the kind of this double stuff Oreo look. It is filled with fluid. So a normal facet joint is like this one, which is a little bit black. It doesn't have a lot of fluid in it, but look at the one above. Big, fluffy, full of fluid, very irritated likely the source of this person's pain. So what can you do about it? Well, there's a special procedure that we do here at Spine West where we can test to see if this is the source of your pain. We can drop a little bit of numbing medicine, some anesthetic, around the edges of the bones here that give feeling to those joints. And we use that numbing medicine to see if we can eliminate the pain. Analogous to going to the dentist with some pain in your mouth and your teeth are all bad, and you say, my mouth hurts over here, and the dentist will start numbing up one tooth at a time, and then you say, hey, my pain's gone. And so that's the likely suspect for the source of your pain. So the numbing medicine is used as a diagnostic tool to determine if this could be the source of a chronic neck pain. So what do you do about it? Well, we have a special tool, a special instrument that allows us to literally kind of make a small little lesion, small little cauterization of the nerve where it runs along the side of the neck bones there. And that can kind of zap the nerve so it takes the pain pathway out of commission for a while. And that can last 6 months to a year, sometimes even longer. But it's a non-surgical way to get a mechanical neck pain under control, again, without surgery. Surgery is always the last stop on the bus. It's usually reserved for people that are at risk for compromising their nerves or spinal cord, or if there's significant instability in the spine. Then you have to get that stabilized and surgerized. But a lot of times you can treat these types of things without surgery. And the other option that you can do, which we've been using more and more lately, is platelet-rich plasma. We talked about that in a previous lecture, where you can harvest these little packets of growth factors out of your blood. We centrifuge, well, we don't centrifuge, we use a special little flow cytometer to isolate the material out, and then we can inject that material along the bones as well, or even into the joints sometimes, and with the idea that this will induce Mother Nature to come to the rescue, help solidify and stabilize this irritated joint, and perhaps give you some lasting benefit. So that's a quick overview of the big red flags for the neck. Again, if you have numbness and tingling, you always want to get checked out, because that implies that you've got a potential for a spinal cord issue. So please seek medical attention if that's the case. And then there's many other non-surgical options that we didn't talk about, some of the basic over-the-counter medications and the prescription medications and things. But by and by, it is typically broken into, is it mechanical or is it neurological? If it's neurological, it needs to be carefully evaluated with a careful physical exam, imaging, etc. And if it's more mechanical, then we try to find out what the source is. So the big thing is you have to trust your body. Just listen to it. If it doesn't seem right, you should seek attention. I hope this helps to keep you on the path. We'll see you next time. If you have any suggestions for future Dr. Cliff's Riffs, let me know, and we'll try to put those together for you. Thanks so much.